Good morning. So we go on with bilateral femto cataract. New paradigm. In Switzerland, it is not easy to perform with both eyes. It is regulated different. But this experience we perform in Switzerland are forever in patients with Down syndrome, where we perform a general anesthesia, and then we perform it bilaterally. But my friend Rupert Benapacha, a huge experience, so you have make an analysis together. So one thing is we perform the cataract surgery one after the other eye between 2 and 4 weeks apart. Or we make it simultaneously on the same time in the same surgery room. We have to talk 3 points. One is the medical point, the social and the economic points, as Steve and Sarah's already have mentioned some part of it. Advantages of a bilateral cataract surgery is the effort and stress for elderly patient halved. It is said they come once and then you perform both eyes. And also the binocular visual rehabilitation acceleration forever in anisometropia eyes. So the recovering for the patients are much faster. And it is a third point. It is a study in Austria. The risk of falling significantly reduced. So you can broken your legs if you don't have the visual acuity. So it is for the patient, for forever elderly patients, is safer to have the visual acuity from the first day. But you have also disadvantages, dangerous. For example, the toxic anterior segment syndrome. It's not often, but it is a possibility. It is unknown, for example, 1 of 1,000 eyes after cataract surgery. So it's less than 1%. And it's described also in the literature, different literature. So it is something that can happen with a probability less than 0.1%. Then it was also already discussed what can happen. And endophthalmitis after 7 days. So you don't see it after the surgery immediately, sometimes. Or the TAS syndrome after 12 to 24 hours, which can happen. So that are the risks. They are not very high, but they are here. And you don't see it immediately, because you can perform your procedure and everything works well, and then you have seen the changes later. But the probability is not high. The economic part, the surgeon saves time and increases efficiency. It depends also for the insurance for each country if it's possible to organize it like this. Then for the institution, it is easier. Greater administrative, laboratory, nursing efficiency are much better if it is possible to do it bilateral. And also, we do not forget social environment and society. So it is said family, social workers, less caretaking, transportation, visits. I think it's an advantage for bilateral cataract surgery. More advantage, it is a single show up at the surgical unit only. One trip to surgical unit only also, so it is one just procedure. And also it is much easier to organize the aftercare period after this cataract surgery. That's another study from Finland, from a Helsinki study, that it is estimated, that's euros in this country, 739 euros per patient. So the cost reduces in this study at 54%. That's a part, that's much, and for each society it should be discussed if this 54% be a big issue. But how we can do it, this bilaterally? So we have to see what is the prerequisites for the procedure. Self-sealing, deformation-resistant incision. We will see that afterwards. Then also the low capsular complication rate, less we already talked yesterday about, that is less than 0.5%. So if a doctor, surgeon should have his own benchmark regarding this literature which is put it here. And it is the ability to explore experience collected from the first eye. That was what Steve already said. The second eye is always easier. What we do in such cases, the mechanical leader up, aqueous povidone 5%. Also the plastic trap fully covered the margin and the lid slashes. That's very important. There is many bacteria. Also separate everything, instruments, viscoelastics, also infusion for both eyes. And it is a double check vacuum machine settings, and what is also very tricky, maybe the power of the IOL. If it's a difference, then it is very important to put implant the right IOL in the right eye. It's not so easy as we think now. Sometimes it should be organized. And finally, wound saline confirmation after 50 to 30 minutes if everything is perfect after surgery. So the patient instruction, antibiotics 3 times a day for 1 week, and also the goggle plastic shield for 3 to 7 nights. Sometimes we put it longer in Switzerland. We give it for the patient 2 at 3 weeks. And as a surgeon, you have to be all the time for the patient at the hotline in the first few days. And then also the follow-up, you should visit the patients. Each fully considered a separate procedure, so you take the infusion completely separated for one eye and for the second eye. And also the viscoelastics. You should not use the same viscoelastics for both eyes. We separate it for each eye. And also regarding the society, the second eye surgery defer if complication occurs. So then you stop it after the first procedure if there's some complication of the first eye. The incision is also a question I have to discuss. The sclerocordial tunnel, where you have an incidence of complication after the surgery as endophthalmitis is lower than 0.07%, and clear corneal incision regarding the study which I made it here is 2.5 times higher. So also regarding the techniques, there is an impact which we have to discuss. So that's Professor Pajic. It is an advantage with the LDV Z8, so we don't change the surgery room. So how we can organize that, make a turnover of one and the second eye in the main setup. So if the surgeon is temporarily, the notice here is the Z8. So you perform the procedure of the right eye, then you prepare completely the second eye with the new procedure packs of the femtosecond laser. Then you change just the place on the temporally of the left eye. You make your procedure with the femtosecond laser and you perform then the second, the left eye. Let us see at the video of Rupert. So that's funny, the surgeon performs himself the preparation of the femtosecond laser. That's good. But here you see this is a scanning. What else is needed for the femtosecond laser with the Z8. It depends, you can perform different procedure. And then it works with the left eye, with the nurse. And here is the earthly phaco device. You see, then it will be preparated during the second eye. Okay. they take everything off, and all new instruments, all new procedure packs you put on the femtosecond laser. You change the position of the surgeon, and then you perform the other eye. Also, you can make your approach temporarily. What we perform in our clinic, very similar, but I'm sitting on the top, and then I perform temporarily with left or right eye. It's also a possibility. Then you don't need a changement of the place of the surgeon. But what is most important is to change everything for left and right eye. Thank you for your attention.